3 gentle ways to manage pain safely and effectively. What would you say if I told you that I am managing chronic pain without prescription medication and I rarely use over-the-counter remedies? Let me ask you, what are your biggest struggles when it comes to managing chronic pain? And what have you tried before that isn't working or working as consistently as you would like? And better yet, most importantly, what are the negative side effects that you are encountering and are really tired of experiencing? The 3 gentle remedies that I'm going to share with you are ones that I put into practice as someone who is 60 years old. I'm managing multiple chronic conditions, and I want to first save money. I want to avoid excess medical appointments outside of those that I need on a regular basis. And I want to better care for myself without feeling overwhelmed and burdened by negative side effects that are adding more harm to my quality of life. Now, before I get started, if you don't know, my name is Tiffany. I am the founder of Anderson Therapeutics. I have worked in the field of health since 1996. I have been an alternative healthcare provider. I am a health educator, a patient advocate, a wellness coach. Big disclaimer here, right here. As a health educator, I am speaking about my own personal experience. Please, please, please speak to your doctor before making any changes that can impact your health. The things that I'm going to share with you today are maybe things that you're already implementing, maybe though not consistently enough, or using them in a way that is best working with the conditions that you're managing. This is a very personal process. Pain management is challenging from a clinical perspective and also from the patient perspective. The first condition that I will talk about and then show you what's working well for me is arthritis. I have osteoarthritis. When I was putting myself through college, I did an internship with the Arthritis Foundation, and I taught a self-help course as part of my internship. Managing arthritis is a well-rounded approach because it takes into consideration your lifestyle behaviors and then how you are taking the tools, the resources, and the tips from your clinician, from your doctor. Even if that includes medication, it's the steps that you implement at home. And that's what makes the biggest difference when you are managing chronic pain. There's only so much that your doctors can do. There's only so much that the prescription medications can do. The rest of it is up to you. It's what we do at home. And when you reach out to other healthcare providers, such as an acupuncturist, I receive acupuncture on a regular basis. Now, that could be completely out of reach and not economical for some. The items that I'm going to share with you today are very affordable, things that you can access at the grocery store and things that you have around at home. Let's start with something really, really simple. Now, you probably saw that I am finishing my morning kombucha drink. I've shown this in other videos before. I am a morning person. I've already finished my fitness routine. So that means that right now I'm not as achy and creaky and feeling as much pain as I did when I first got out of bed. With arthritis and someone who has artificial joints, I have that really creaky, almost a robotic feeling in the morning as I'm getting out of bed. It takes me a while to warm up and get going. The one reach for more than anything, look at this. This is an ice pack. I have a variety of sizes. You probably have these in your freezer. If you don't, get a variety of sizes. This is one I picked up recently at a benefits fair at my employer. Another giveaway, I have some that are a larger size that I drape over my shoulders that I put at my low back when I'm sitting at the computer for long periods of time. Some of them are a lumbar support that I put at the base of my low back when I'm sitting for long periods. Ice is so effective at decreasing inflammation, and it gives us a bit of a numbing effect. Now, ice is something that you want to use with caution. Having it on bare skin can be unpleasant for one thing, and it can be harmful. You want to pace yourself. That's where a gel pack like this, anything that's going to naturally warm to your body's temperature, those are ideal because we don't want to overdo it with ice. We don't want to damage our skin. We don't want to cause harm. Our skin is an organ. It's one of the largest organs of our bodies. Those muscle aches, ice is a way to quiet and calm and ease the feeling. Take away that chronic pain. It just gives it a little bit of a calming effect. Little to no side effects with this. Know how to use it wisely. These are inexpensive. You can take them on the road, take them on a trip. I travel with ice packs. You can get those first aid kit ice packs that it's got a chemical response. You may have seen these before, and you pop it, and pretty soon you've got an ice pack. Those are ideal. You should really have one of those in your first aid kit. They're really, really effective. Another item that I use for arthritis, this just looks like a garden spray bottle. What it is, though, I have dissolved. These are magnesium flakes. Now, I take Epsom salt soaks in a bath or go to a mineral hot springs as often as I can, though again, they're not as accessible, they may not be affordable, it may not be comfortable, it may be outside of your area. Utilizing an essential mineral such as magnesium, dissolving it and putting it in a spray bottle. The way I use this is after a shower, or even when I have a little achy spot, such as right here, upper trapezius, right here, that shoulder muscle. Now I have the salts dissolved in here. I'm just going to spray some of that into my hand. As you can see, I use it often. I need to refill it. And I'm just going to place this right on my bare skin. Now, when you spray something like this, consider this before you jump in. Magnesium, this is much like Epsom salts. This is a salt, so it's going to give what I like to call a spicy feeling. So after a shower, when my skin is dry, there's no moisturizers on there yet, and when I'm leaning forward and I'm spraying this on my back or my hips, I have artificial hips, this is going to give kind of a tingly sensation. So this may be uncomfortable for any of you who may have a skin disorder, eczema, a rash, especially cuts, nicks, those type of things. This may not be the most effective for you. This is where exploring options and taking advantage of, perhaps on your shoulder, and I have lotion on already, so putting on a little bit of this, I'm still getting a bit of the benefit, though it's not as impactful as when I'm putting it on bare skin, when it's actually going to be absorbed quickly. That's how these works. Any of those topical items, they're absorbed into our bloodstream via the skin. That's how any of our, think about medications that use patches. That's how topical items like this work. A Bengay, an Aspercreme, those type of things. Now, I'm not being sponsored or anything. If you do visit my website at andersontherapeutics.com, there are affiliate links. There, if you go there, you can buy these at any drugstore. The next one, this is a biggie. Okay, arnica. This is something a naturopath, one of my physicians decades ago, first told me about arnica. This is when my son was still at home. I have been an empty nester for a very long time. Arnica is a homeopathic. It's a plant-based. This is a gel. This is something that when my son was still at home playing a lot of sports, and I have been active my entire life, bruises, strains, sprains, that type of thing, muscle aches, arnica is a miraculous find. I definitely have an affiliate link on my website for this one, and I will share this one only because a lot of people aren't using arnica, and this is one that even my own surgeon, when I had artificial joints installed into my now new bionic body, I was told to start using arnica as soon as I was able to. That was part of the recovery plan. That was something right from a clinician. That's impactful. One of the ways, with arnica, a formula like this, you want to put this on skin that's not broken. So again, this is ideal for bruises, for soft tissue injuries like a strain or a sprain, that type of thing. Now, was this a cure-all? Certainly not. And remember, I'm a health educator. I'm talking about these as items that I have been told about from clinicians, that they're sold, over the counter. This is something that you can get at a drugstore, certainly on Amazon, any of those other sites, and it's very inexpensive, and a little teeny bit goes a long, long way. I can take it, you probably won't even be able to see here, it's a clear gel that comes out. I travel with this. It's something that I always have in my first aid kit. This is phenomenal. And it will take a bruise from, and now that I'm more mature, tell me if you can relate to this, I bruise more easily and they take longer to heal. This speeds up that process. When my son was playing sports a lot, and earlier, when I was younger and also still really active in a variety of sports, this would take a pretty nasty looking bruise, down to like the yellowing stage within 7 to 10 days. Now, your results may vary. The other way you can take arnica is by these little packets that you dissolve under your tongue. Again, this is a homeopathic. This is something that my doctor, my surgeon, other clinicians, when I was healing from I experienced three different hip replacement surgeries. I had the first one, install went really well. The second one I had at the 6-week checkup, it had failed. There was a fracture in the femur, and I had to have a revision surgery. It was awful. I used arnica as soon as possible. This is one that I started taking right in the hospital. These work internally. So when you have internal damage, things where the skin is still healing, you've got a cut, you've got sutures, this is something that was recommended as part of my recovery plan. Was I using other prescriptions, medications at the time? Certainly. Hip replacement surgery is incredibly invasive. It's very painful. This also, because I was using this, I was able to wean myself off of the prescription medications much sooner than I expected, and it astonished my medical team. They were very impressed, wanted to know what I was doing, and by also using ice, I had major ice packs wrapped all over my hips. If any of you have had joint replacement surgery, any type of procedure, ice packs are common. Why not have a lot of these at home and use them often. Use them wisely and use them as directed, because when we have chronic pain, when we have a chronic condition, this is your body's cry for help. It's an invitation, and by caring for ourselves, by answering that cry for help with something that's less invasive, less intrusive, and certainly less expensive, this is a heck of a lot easier on my stomach because I'm not taking anything when I use an ice pack. My morning workout routine. This is my endorphin rush, so there's a natural pain reliever right there. So whether you're able to stretch, take a walk, do something more aggressive, cardio, going for a hike, strength training, whatever you're able to do, moving your body to the best of your ability, that is going to give you a natural pain reliever. My morning drink. This is the kombucha powdered blend that I have with some apple cider vinegar. I have some low sugar fruit juice in here and just water. This is a way that I am extending my morning fast, because foods can sometimes have an inflammatory effect on our bodies. By extending my fast in the morning, I'm not denying myself. I'm simply waiting to eat a full meal when I'm truly hungry. That is the way that I am answering what my body needs. Now, this is another one. We're all different. And by eating foods that are wholesome, nutritious, and are working with your body rather than against your body, that's another way to better manage pain. Now, if I was to dive in and have a big hearty breakfast, if I wasn't hungry, if I was still digesting something that I had just barely eaten, that would be a burden to my digestive system. As an adult who has chronic conditions, do you already know that digestion takes a lot of energy? That requires a lot of effort from our body. And when we're pushing more to do onto our system that's maybe already compromised and not at its best, we're going to have a dietary consequence, such as feeling sluggish, bloated, inflamed, and in pain. This isn't a guilt trip. This is part of my motto as a health coach, as a health educator. When anyone has ever come to me and asked about making a change to their diet, or perhaps they have a weight loss goal, my motto is eat what you want. Food is wonderful. Food is delicious. Food is beautiful. Food is to be enjoyed. Food is also a source of nutrition. So eat what you want. Simply accept the dietary consequences of the choices that you make. So I'm going to remind you again, these are the 3. Ice packs. Ice. Inexpensive. You probably have it right now. Magnesium. Whether you use it as a spray, this is more accessible for a lot of people who maybe it's more challenging to get into the tub and soak in some Epsom salts. This also travels well. So perhaps trying this, if your skin can handle it, try it on an area of your body that isn't as sensitive to see if it works for you. You can also soak in these. You can soak in magnesium flakes just as you can with Epsom salts. And the biggie for me, arnica. Arnica is a fabulous homeopathic remedy that has been around for a very, very long time. This is something that comes from a plant. There are a number of research papers, all sorts of information about the benefits of using these items. I hope this was useful. Tell me in the comments, what are some of the chronic conditions that you're dealing with, and what methods are working for you? Are you ready to try something that is less intrusive? And do you feel that you could try some of these remedies, not necessarily taking away anything that you're doing right now? This is as a supplement. This is an addition to what you're doing, because we know that managing chronic conditions, it's your new role. It's a job. It's something that you're carrying with you, because our chronic conditions are part of us. It's part of our story. So why not add something beneficial, add something caring, add something supportive to that story? And it may relieve some of the burden and the pain, because the pain is not only physical, it's emotional, it's psychological. It impacts all aspects of our life. There's a sigh of relief. Take good care of yourself. Let me know in the comments if this was useful, helpful. Visit my website if you'd like more free resources, tips, and tools to help you better manage chronic conditions. Thanks for watching.